Hi, it's Tom Brett. Let me introduce fracture splinting for digits. This is not a Brett's course, although it may develop into a fracture reduction course in the future. Tom Brett, therefore, accepts no liability for implementation of any part whatsoever of the contents of this video clip. The patient is a 54-year-old female with type 2 diabetes mellitus. Let's look at the equipment needed in the acute phase of this injury. Sterile irrigation solution. Sterile dressings. Sterile swabs. Breathable fixing tape. A protective sleeve to cover the sterile wound dressings and later to allow air to access the injured digit while allowing easy removal of old dressings. Sterile probe, scissors and scalpel. Strong cutting scissors for adjusting the length of the splint. Fixing tape, initially to fix the splint to the adjacent digit and then for fixing the injured finger to the splinted finger. Finally, the splint, in this case a wooden tongue depressor. The injury was a crush fracture with skin breakdown on the right third distal phalange of the upper limb. In addition, there was a subungual hematoma. This clip was made 4 weeks after the original injury. The skin breakdown was now healed. The hematoma was exsanguinated by careful debridement of the nail, and pressure to complete the exsanguination was applied by the dressing and splint. This was the area of the fracture. Let's look again at the area of the fracture. Fitting the splint. In the acute phase, both interphalangeal joints of the adjacent finger were splinted in order to give maximum protection to the injured area. The therapeutic object was to minimize movement to the injury site to allow union. As the skin healing and union of the fracture progressed, the length of the splint was reduced. Checks were made that any movement did not impinge on the splintered finger and that the movement did not cause pain at the fracture site. When the check for pain-free movement had been made, the splint was resized to prevent movement at the distal interphalangeal joint. Next stage is taping the injured digit to the buddy. Now that the splint had been secured to the adjacent digit, the buddy. The injured digit was dressed and secured to the buddy. At this stage of the healing process, it was only necessary to fit a protective sleeve to the injured digit. Firm but gentle pressure was applied to the injury site to check for comfort. Lightly fix the protective sleeve with breathable fixing tape. Complete the final taping and comfort check. As we approach the end of this video clip, I'm going to review this particular case. Because the initial splinting had been done on the injured finger, a course of antibiotics as a prophylactic against infection was necessary. However, overriding that aspect, the general principles of care were cleaning and separately dressing the wound, using the buddy as a friendly splint to allow maximum movement but to give restraint and protection from further injury, checking for nerve and blood vessel damage initially, followed by daily checks for signs of infection when the dressings and splinting were changed. The outcome was excellent, with no deformity. The patient is now receiving physiotherapy to restore function. From Tom Brett, goodbye for now.